Milestones. Well, I don't really think of my career in terms of milestones, but I have been a community pharmacist for just on 60 years. I suppose that could be considered a milestone. But during that time, I was also on the national board of PSA and served a term as national president. I was never one to sit on the sidelines and complain, so I thought the best idea, way back in my early 20s, I think, that if pharmacy was going to be my career, I wanted to have a say in how it was going to develop. I think self-care is really important for patients. It's important for pharmacists as well in looking after our patients, but people will get much better health care if they have some involvement in their own health care. Now that doesn't mean to say they do all that without reference or support or advice from healthcare professionals, doctors, pharmacists, nurses and so on. But if we can enable patients to take a greater role in their health care, then we're going to get better health outcomes. That's good for our patients, it's good for us. If our patients get better with our advice, then they're going to be loyal patients with us, and that's good business as well as good health. You know, over the last 10, 15, maybe even 20 years, pharmacy has become much more involved in providing advice, in counselling and support for patients. Personalised medicine has become more prevalent, and now it is so important that we pharmacists give advice that is personalised and relevant to specific patients to optimise their particular therapy. I'm really optimistic about the future of pharmacy, particularly community pharmacy. Now, we've seen a change in the way pharmacy's been practiced recently. There's been some regulation proposals put forward by government that are certainly going to have an impact on pharmacy and the dispensing part of pharmacy. But pharmacy's future is more than just dispensing. It's very much in the services, it's professional services. It's providing extra value to our patients over and above what we can do in just dispensing medicines. It's providing advice and information and the best possible product in non-prescription medicines as well. But we're going to get more and more products that are now prescription only available for us to provide directly to our patients with the most appropriate advice. That's where our future lies, I'm sure. Community pharmacy, you know, is very much a collaboration. It's a collaboration with our peers, with our professional organisations. It's a collaboration also with industry. You know, companies such as Viatris, for instance, provide enormous support for us by way of information particularly, but also developing the most appropriate products that we can provide to help the healthcare of our communities. In Queensland, in New South Wales and soon we hope in Victoria, there's been an expansion of the role pharmacists have in the provision of various medicines. I think it's just a natural progression and a great opportunity for the future. I'm really optimistic about the future of community pharmacy in Australia.